Good evening, guys. I've got discussion D for you. We're discussing levothyroxine, which is a thyroid medication. Long-term use causes bone issues. So we're going to go through that tonight for discussion D. So please join me in tonight's presentation D, bone health, which falls under healthy aging for me. So here we go. The article discusses research linking levothyroxine, which is Synthroid, one of the most common prescribed medications in the U.S., to an increased risk of bone disease. Approximately 23 million Americans take this synthetic thyroid hormone daily to regulate energy, weight, and hair growth. The study raises concerns about the potential impact of long-term use on bone health. Would you like more details on how levothyroxine affects bone density or alternative thyroid treatments? Levothyroxine, a widely prescribed thyroid medication, has been linked to bone density loss, particularly in older adults. Research suggests that long-term use of levothyroxine, even with a normal thyroid hormone ranges, may accelerate bone density loss. Bone density mass reduction, which means bone density loss, guys, in English for you guys, increasing the risk of osteoporosis. The mechanism behind this effect is thought to involve excess thyroid hormone, which can stimulate bone turnover, leading to weaker bones over time. Some studies indicate that individuals taking levothyroxine for 6 years or more show greater bone loss compared to those not on the medication. Would you like to explore ways to mitigate this risk, such as adjusting dosage or incorporating bone strengthening strategies? If you're taking levothyroxine and want to protect your bone health, here are some strategies to consider. Okay, guys, number 1, optimize dosage. Work with your doctor to ensure you're not taking excess thyroid meds. Okay. Give me 1 second, please. Excess thyroid hormone, which can accelerate bone loss. Calcium and vitamin D intake. These nutrients are essential for maintaining Strong bones, consider dietary sources or supplements, weight-bearing exercises, activity like walking, resistance training, and yoga can help mitigate or maintain bone density. Bone density monitoring. Regular DEXA scans can track changes in bone mass and help adjust treatment accordingly. Alternative thyroid treatments. Some patients may benefit from combination therapy or adjustments in medication type. Okay. Let's see. Would you like to explore specific dietary recommendations or exercise routines tailored to bone health? There are several alternative treatments for thyroid issue. Okay, that can complement or some cases modify conventional approaches. Here are some options. Dietary adjustments. A nutrient-rich diet can support thyroid function. Some experts recommend avoiding geothyroidogenic foods like raw cruciferous vegetables and incorporating selenium rich foods, thyroid hormone metabolism. Herbal supplements contain herbs like ashwagandha and bladderwrack have been explored for their potential to regulate thyroid. Okay, vitamin and mineral support. Deficiencies in vitamin B12, iodine, and zinc can impact thyroid health. Supplementing approximately may help, apparently may help. Probiotics and gut health. Since gut health influences thyroid function, maintaining a balanced microbiome through probiotics and fiber-rich foods can be beneficial. Stress management. Chronic stress can disrupt thyroid hormone balance. Acupuncture may help regulate stress related thyroid. Thyroid dysfunction. Okay. Complementary therapies. Some individuals explore functional medicine approaches, including adaptogenetic herbs and alternative thyroid hormone formulations. Would you like to explore specific dietary recommendations or supplement options tailored to thyroid health? Absolutely. A thyroid-friendly diet can support hormone balance and overall well-being. Here are some key recommendations. Iodine-rich foods, essential for thyroid hormone production, include seaweed, iodized salt, dairy, and fish. Selenium sources. Herbs regulate thyroid function. Basil, nuts, and tuna. Eggs and sunflower seed. Zinc and iron. Important for hormone synthesis, found in lean meats, shellfish, legumes, and spinach. Vitamin D supports immune function and thyroid health. Get it from fatty fish, fortified dairy, and sunlight exposure. Anti-inflammatory foods. Reduce oxidative stress. Include berries, turmeric, green tea, and leafy greens. Limit thyrogens. Some raw cruciferous vegetables like broccoli, cabbage, and kale can interfere with thyroid function if consumed in excess. Avoid ultra-processed foods. Excess sugar and refined carbs can disrupt hormone balance. Would you like meal plan ideas or specific recipes tailored to thyroid health? Dietary needs vary depending on whether someone has hyperthyroidism, underactive thyroid, or overactive thyroid. Thyroidism, Hashimoto's disease, increase iodine intake. Seaweed, fish, dairy to support thyroid hormone production. Selenium-rich foods. Basil, nuts, tuna help regulate thyroid function. Iron and zinc, lean meats, legumes, and hormone synthesis. Limit geothergens. Raw cruciferous vegetables, as they may interfere with thyroid function. Okay, last page. Avoid ultra-processed foods that can disrupt hormone balance. Hyperthyroidism, Graves' disease. Reduce iron intake or iodine intake to prevent excess hormone production. Increase calcium and vitamin D to counteract bone loss from high thyroid activity. Consume anti-inflammatory foods, berries, turmeric, and support immune health. Avoid caffeine and processed sugars, which can exacerbate symptoms. Would you like meal plan ideas tailored to a specific thyroid condition? Okay, guys, so that is it for tonight. I see everybody tomorrow for shows. Hope everybody has a good night. I see you sometime in the afternoon for shows. For now, Gator Wellness, take care, folks.